why people, are actually having weak bones. Is that the reason why, even the smallest of injuries is affecting them so much?
Bone quality, I think it's a no-brainer for any orthopedician. The bone quality is getting weaker by the day. Okay, it's not getting better. It could be our indoor lifestyle, our toxic food habits, where we eat any and everything which is marketed and publicized, which looks fancy, promising. But whatever the case, whether that fracture needs a surgery or doesn't need a surgery, the anxiety level of parents is same. Okay, I'm not saying it is wrong. As a parent, they have all the right. And definitely, if I was not a doctor, maybe I would have worried the same if I was a parent. Even as a doctor, I still worry the same.
How, fracture patterns are different in men and women, and which gender is more prone? Hello and welcome everyone. Welcome to the episode 6 of the Y Factor, and we have a very special guest today. And our special guest for today is Dr. Santhosh Ram Gaddam, and he's a leading orthopaedician and a trauma surgeon, and a key member of the SRS Ortho, the first of its kind, a three-member subspecialty team redefining trauma and orthopedics care in the region. Trained at Andhra Medical College with advanced fracture specialization from Ganga Hospital, Coimbatore, Dr. Santosh brings a deep expertise in complex fracture, neglected injuries, and trauma cases in both children's and the elders. Known for his precision, ethical approach, and patient first mindset, he is behind some of the city's most remarkable orthopedic recoveries. Join us for the conversation today, and today we are going to ask a lot of whys behind a lot of fractures, bone breaking, and polytrauma questions, and we're going to uncover a truth about modern bone health with Dr. Santosh. So thank you so much for joining us today, sir, and we are very glad to have you. And how are you doing?
Yeah, hi, Afsar. Thanks for the intro. Yeah, I'm doing good.
Yeah. So, Dr. Santosh, so I think we are going to have a great conversation in terms of like all the bone health fractures and, why the injuries are happening in the first place and how people can take the
Mm.
precautions post injuries and surgery, right? And I think it's a very vast topic, and we would try to make the most out of it and ask you relevant questions, right? That actually addresses the questions that usually a common people have, like common people like me, who are like 90% of the population, and we try to make it more simpler for people to understand. And yeah, before dwelling down into that, sir, I just want to understand from your humble beginnings, right? So let's rewind a few years back and then understand what is Santosh, right? Like how was Santosh before he became a Dr. Santosh, and how was his schooling, and how was your family background, and why did you choose medicine to start with? Yeah.
Uh, okay. I don't think the word humble is very appropriate because I never had any problem from starting from my childhood. By God's grace, we were an okay to do family, a big family, definitely a joint family like the olden times. But yeah, I never had any problems. So I can't just call myself humble. Yeah, I was good from the beginning. It was good for me from the family side. And see, I come from a family of doctors. Every generation had a doctor. So doctor or medicine was nothing new to me. My grandfather was a doctor. My maternal uncle was a doctor out of the 10 kids. I mean, my mother's brother. And in the next generation, I've become a doctor. And my mother was a nursing professor in the same medical college where my uncle did his MBBS from. And my father was the personal assistant to the superintendent of the very same hospital. So I think my playground, everything has been one of the city's largest hospitals, maybe the state's largest hospital, the King George Hospital, KGH in Visakhapatnam. Whenever I had free time, that is where I used to go and play. So I don't think doctors and hospitals are anything new. So I was living in such a world. So obviously, it's natural that something like that strikes to me. I went ahead, pursued it. Like I said, I had all the support I can from the family, never had any problems. So I was blessed to have all the resources. Went ahead. Luckily, I played my part without any, shortcomings. God's grace and family support. Yeah, I did become a doctor. Maybe there are a few others who had to go through a more tougher journey than me. The ride was easy enough for me.
Mm-hmm.
at least till MBBS. After that, anyways, the struggle is the same for anybody. So
Yeah.
once you're done with your MBBS, when you choose your specialty, so there is nothing like an easy road for anyone. The road is really, really tough. And like the saying says, what do you call that? When going gets tough, the tough gets going. Really, it's a test for our patience and perseverance after MBBS when we choose a specialty and when we pursue the higher degrees and all. Yeah, that's in brief. Maybe just like any other doctor, nothing different.
Mhm. Got it. So also, sir, I think you did your obviously like MBBS and then you got in super specialty, right? And why orthopedics
Mm.
in general? Like you have like a lot of other branches, right? And super specialty. So why this? And then what made you like, get interested about this in the first place? Yeah.
Yeah, so like I've told you since my childhood, since I've been in this medical background and all this, but they were all medical doctors. That is, they are not surgeons, whoever was in my family. So, but somehow I don't know why, but I felt like surgical branch was my calling even before I entered into MBBS. That is when even I had no idea of what a MBBS is going to be. But the moment I entered MBBS, this has even become stronger because in first year there's something called anatomy where we just, like how the public knows it. Like we'll be learning on dead bodies. That's how the public knows anatomy is. So we'll be learning all that. So, a weird thought was coming to my mind like, so these are the structures inside someone's body. So they might be injured, hurt, damaged, altered, and the surgeon gets a chance to set them right. I don't know, maybe I was fantasized by it. I felt like it was some superpower or something, like our, you know, like all the superheroes. It was strongly, imprinted in my mind that I should become a surgeon. I think that is how I fixed that I should become a surgeon. For orthopedics, why I chose orthopedics, now that you ask, I told this to a couple of my close friends also. So when I was in my third year, just before the final year exams in the year 2003, so my mother had a major road traffic accident. It's close to, almost a major road traffic accident, even small hither and thither in the management, I would have lost her. It was a very pretty bad accident. I came to know about the accident after 8 or 10 hours. So at that time, she had really, really bad skeletal injuries, bad fracture in her arm, fractures in her hands, fractures in the feet, multiple rib fractures, a chest injury, a lot of what you call as polytrauma. The then orthopedic surgeon has done a tremendous job, which at that time I didn't understand. I thought maybe, yeah, she had a fracture, the orthopedician treated, she was all right. But slowly, as I started to know orthopedics, so he has done a marvelous, even on today, still that is a very difficult thing to manage. This might have happened 22 years ago, but still even today, that was a very challenging case to treat. And no, if you talk to my mom, you'll never know that she had such a major injury. That's how good her outcome was. So that is when I decided, slowly I got into orthopedics. And that is one major incident, I think, which pushed me towards handling fractures more than anything else in orthopedics.
Got it. Got it. Also, sir, with you have like a few decades of experience under your belt, right? And then once you chose orthopedics and and you became a surgeon, and then dealing with the trauma and the polytrauma cases, right?
Mhm.
What is one major thing you've seen when you started your journey, and right now after these many years of
Sorry.
experience in this journey,
Mm.
do you think anything has major shifted, like before getting into orthopedics, what was your thought process? And now that, you are here after like so many years.
Uh, no, nothing much shifted because when we undergo this training, we witness the change.
Mm-hmm.
So we are part and parcel of that change because we are in that field. So whatever change is happening, we witness it during that training.
Yeah.
The only thing which we will not be aware of is during our training is how actually, the logistics, the sensibilities, the other constraints from the patient side or the relative side. So what implications, some factors like your region of, I mean, the place where you get injured, or the finances which govern the treatment, or maybe the background of the hospital where you're working, the resources, all many such things. See, all these are not in the textbooks. So the most of the textbooks, whatever we follow, are written by the developed countries. All the standard textbooks. Of course, now even we have our own textbooks, but still. So these you don't get a picture of these unless you get into the field. That is where a good professor, good teachers help come into place, and also your intellect, your understanding, and definitely your own experience. So I think nothing much has shifted. If anything has shifted, I think lot and lot of awareness has come up, maybe because of such interviews or doctors coming on various platforms and sharing their experiences and insights. Internet, major development. At least when I was a resident, there was nobody looking at the internet and coming back. Yeah, it has the goods, bads, and uglies of internet are there, but still, I think even if benefits a single person, I think it's a boon. So that is the only shift I see nowadays. Uh, People come to us with some knowledge.
Mm-hmm.
Sometimes it is advantageous, sometimes it's not so advantageous, but still, the only shift I witnessed as far as care is concerned, like how do you manage a patient? It has like, a phenomenal drift. You can't imagine. Like when I was a resident and now when I practice, huge difference.
Mm-hmm.
Almost, it's like at that time, what we thought was, oh, this can't be done. This is impossible only in our dreams and thoughts. Now that is very much a commonplace. So such has been the shift in care. So I think it is our duty to see that such care goes to maximum, if not everyone, to maximum set of people as possible.
Yeah.
That is a little bit difficult, but yeah, we are trying to play our part. That is the only shift I think I've seen.
Got it, got it. So in your tenure of experience, right, and you
Mm.
worked, or worked with like the most complex cases and you dealt with like a lot of severe accidents, right? What is the one common, case that you usually deal with? For example, let's say if you're, have like 100 percentage of the cases you've dealt with, but then
Uh,
60-70% one case which is the most repetitive or something. So what is that and what are the rest? So how will that follow with the rest? Yeah.
no, no. See, we can't. If you ask me repetitive, there's nothing repetitive because even suppose say if today you're getting something, say a fracture in your thigh bone, back to back for the next 15 days, suppose say I get daily one or two fractures of the thigh bone, but still on the 16th day, managing that is a challenge because fractures are so diverse. So rest all conditions in orthopedics are different, but a fracture, so that is because trauma is something which is dynamic. And
Wow.
remember, it's not just the fracture which we are treating, it's a patient we are treating.
Yeah.
So that is very dynamic. So we can't label. One thing I can tell you is I can't tell you repetitive cases, but falls are one thing which happen on a daily basis. Forget
Mhm.
accidents. That is a different thing. We'll talk about it if there's scope. So falls, that is your mother can fall, my father can fall, somebody else's uncle can fall. In the elderly. So for the elderly, when their bones are weak and all, just a small fall is enough for them to fracture.
Mm.
So I think on a daily basis, if you ask me repetitive or common cases, I think the hip fractures, which hip and spine fractures, which are very common after a fall. So
Mhm.
these are common things which come on a repetitive basis to us, to
Got
anybody.
got it.
Now that because I've had considerable experience, I've had considerable expertise, and I've become a senior, a lot of other surgeons refer cases to me, so I get a lot of cases consistently. That might not be the case with everybody else, but yeah, these cases, like what I told you, the fractures in elderly, I think everybody will get them once in their careers.
Mm.
They're common cases, may not be tough cases, but yeah, that is one thing which repetitively comes to us,
Got
hip
it.
fractures in the elderly.
Got it. And what are the most complex ones? Like, let's say, what are the most uncommon cases that usually?
They are not uncommon as one thinks, uh, but yeah, they're rare when compared to these simpler fractures. But so when in severe motor vehicle accidents or falls from great heights, So you get something which is called as a polytrauma scenario.
Mm-hmm.
Okay, so those are the most difficult cases. So polytrauma, like, is poly means many in English.
Mm-hmm.
So trauma, anyways, everybody knows is getting injured. So
Okay.
there are many injuries in that particular patient, not just a one fracture or two or three fractures. So apart from fractures, he would be having injuries. Like he might be having a head injury, a chest injury, an abdominal injury. He might have ruptured an internal organ. He might be bleeding into one of your internal cavities. So all these are called all these when they occur together in a single patient
Mm-hmm.
because of a single incident. That is called as polytrauma. They are most challenging cases to
Mm-hmm.
treat. Um, in that, if you ask me for an example, suppose, say, I mean, just to make you understand, you see, it can happen to anybody. We don't know who will be in the car seat, which is going at 200 kilometers or 150 kilometers per hour, who will be in the rear seat, who is in the front seat. See, we don't know.
Yeah.
So it can happen to anyone.
Yeah.
So those are the challenge. So polytrauma is one such scenario. I
Got it.
hope you.
Yeah. Yeah. So, coming to that and adding to that, the most complex cases you've dealt with, right? So, what is the one
Yeah.
case? I know you deal with like a lot of cases on daily basis, which is like,
Mm-mm.
takes and also like it requires like to deal with like a lot of fractures and injuries at the same time. But if you have to just say what is the one case that stayed with you, and that was something that actually changed the way you look at all these surgeries and all these accidents and how you deal with. So what is that one case which is the most complex and the most challenging for you? I know there are like a lot, but then like what is that one,
Mm-hmm.
the rest?
Yeah, no, no. See, there are definitely a lot of cases. Uh, Now, because like I've told you, I get a lot of cases referred to me, particularly for management of these polytrauma, especially multiple injuries. But one case which stays with me forever, even before I become an orthopedician, is my mother's polytrauma. Like I've told you, that is not going to leave me anytime soon. If you ask me about cases I treat, there have been quite a few difficult scenarios which I've treated. Yeah, I'll see. I can tell you one thing. So I'll cite two examples. The reason why I told you I'll cite two examples, I have a small reason behind it. So one is a 17-year-old guy, 17 or 16-year-old guy. He is known to many doctors across the city. I at least would have gotten phones from 50 or 60 doctors. Seven or eight of them have been my own MBBS classmates who have called me. Whatever reason, he is known to many doctors and many other important people in the city. Anyways, that they never pressurized me or anything. So he was a 16 or a 17-year-old guy. He was aspiring to become obviously an engineering master's graduate or whatever. I don't know, whatever reason, he had a fall from a great height. He
Okay.
fell from a very great height.
Okay.
He had, see, if you can build up a sequence, he had a clavicle fracture. He had a fracture in his forearm bones. He had a fracture in his hip. He had a fracture in his thigh bone. He had fracture in his both the feet. He had multiple rib fractures. He had an injury to his lung. He had a ruptured spleen. And on top of it, the injury which actually, with which he was, I mean, which was more concerning for the first center to which he has gone for treatment was he had an open fracture, that is, fracture with a wound in his arm, which was bleeding like hell. So the main blood vessel was cut because of the fracture and he was bleeding out of it.
Okay.
And he was brought to us in a state of shock. Shock is suppose if whenever you have severe blood loss, so your BP, everything goes down, your system start to shut down. So that is called as like literally shock. You know, medical terms, it's a shock, a hypovolemic shock.
Mhm.
So we had to, she was referred to me. Okay. See, in polytrauma, one thing is it is not just anybody's case, it is everybody's case.
Mhm.
So you need a neurosurgeon to treat with, to deal with the head injury. You need a thoracic surgeon to deal with his chest injury. You need a plastic surgeon to deal with his open injury. You need a vascular surgeon to deal with his cut blood vessel. And most important of all, you need a critical care and intensive care specialist who can actually take care of his resuscitation. Resuscitation is what we do to treat them in such acute scenarios.
Mhm.
And all of them should be working in unison.
Mhm.
It can't be like I do my part, tell him, okay, now it is your turn. Everybody has to work simultaneously. And see, just imagine seven, eight different people with different mindsets have to work towards one goal. So
Yeah.
all of them should be thinking straight. All of them should be thinking at the same time and the same thing
Yeah.
with a
Yeah.
single goal. So that is where, good centers and good doctors, good, by the word good, I mean experienced and who have formal training and expertise in managing such injuries come in place.
Yeah.
You know, that is very, very important. And so we took him immediately into the theater because we needed to stop that bleeding. We operated on him. To cut short the story, now 7, 8 years, at least 6, 7 years past treatment. Now he's 25, 24 something. He's happy, he's doing his master's. See, he's so happy and so recovered, we don't even get to hear from him. So that is how settled. No, we wish we don't hear from patients for all the good reasons.
Yeah.
Okay.
Mhm.
So I think that is, as I talk to you now, I realize that it is a more peaceful feeling not to hear from
Yeah.
them. They're leading their life peacefully. So that was one really challenging case. The other case is almost a similar injury without the vascular part happened in a 73, 74-year-old. So though he was having something called a fat embolism. So when so many bones fractured, the whatever marrow is inside your bones, it travels to lung, and this condition called a fat embolism. It is very risky. The first question he asked me was, how bad is the injury? So we tried to tell him, obviously. He's like, see that whatever you do, I don't become a burden to my
Mhm.
family members. If something is really bad, better see that I don't go through all the process and see that I meet my last soon. I don't want to burden my family members. No, so now we are faced with such a situation where we have to act sharp. At the snap of a finger, we have to take decisions. We have to think on our tones. And now someone speaks such things to us. See, you can't just tell, keep quiet, let me do a job and all. We should be able to handle that situation also with a little bit of sensibility and subtleness. Just one word of assurance or something. And I'll tell you that patient was having such a positive intent in his mind.
Mhm.
He recovered in less than 8 weeks or less than 3 months. He recovered. He was out of his bed. A 73, 74-year-old with such bad injuries out of his bed. Anybody could have treated him. Anybody with the same level of expertise could would have treated him the same way. But his intent is what made him recover so fast. So sometimes even patients do help us be successful. I can never forget him. This was very recent. I mean, compared to the older one, this was just 19, 20 months ago. Because recently I presented this case at a geriatric conference also.
Got it.
So this will stay with me because I don't think I'll ever see some 73, 74-year-old recover so fast with such bad combination of injuries.
Got it.
That is a challenging experience to me, a challenging memory, maybe more than a case. And lot of such cases.
Yeah. Got it. So over here, you think like intent plays, big role over here, right? Like, do you
No,
and
no,
how do
no.
you make sure, because there are like a lot of people who are young, but then when they go through something, and obviously they come in shock and trauma, and then it's very hard for them to process what's happening, given all the injuries and the state they're in, and then mostly even the young people sometimes they lose that motivation, maybe nothing can actually happen to me and then this is how it's going to be. And what do you think that intent and the mindset, how mindset can affect a patient's recovery? What is your take on that?
Yeah, definitely. See, there's a lot of even scientific explanation also if you go through the evidence and all. And from what we see as clinicians also, you can never beat a positive mindset. I'm telling you, if that guy refuses to give up, it is really hard for a condition to defeat him. If everything is going right? Like suppose if he's getting right treatment in the hands of a right doctor, and if that guy fails to give up, however bad the situation is, there are possibilities, and there, in most of the times, he will come out of it. Positive intent has a very, very big impact.
Yeah.
You need to trust the doctor who's treating you.
Mm-hmm.
No doctor on this earth would give you any bad advice.
Yeah.
And it's no problem asking him doubts.
Mm-hmm.
But I think you have to take that leap of faith, like how you call it popularly, just blindly follow.
Mm-hmm.
Most of the time we'll be all right. But for that, you should have a positive intent.
Got it.
Nothing can beat. And if I can add, this may not be, you know, an orthopedician speaking. Younger generation, I don't think younger generation have such a positive mindset, especially as is Zen Y Zs or whatever you call it. I don't even know what you call them. I'm sorry for that ignorance, but see, because I think everybody of us, even the richest of rich people also, the yesteryears and maybe up to my or my previous generations,
Mm.
somewhere or other in life, they have been through hardships. And, there was no such influence of so many factors on their mindsets, and so much was not put into them until they came at the right age and all that. What it's a big debate. We can't discuss all that, but the youngsters day by day, they're getting panicky with, see, I understand if your joint is dislocated, yeah, you're bound to be worried. But even if we try to tell them this can be put inside, you will be all right. It's just a matter of couple of weeks or 3 weeks and all. Someone who's not even working, who's not even the bread earner, who doesn't even have to worry for finances, also panicking like hell for smallest of injuries also. Just imagine, God forbid, nothing should happen to them, but just imagine somebody who is conscious enough to listen to what has happened to him with such big, big bad injuries. If
Right.
he doesn't have a positive intent, and if
Got
his case, it does have, and there's enough scientific evidence that you know you stay positive, you'll pull it off.
got it. Got it. So adding to that, sir, I think it's really important, right? Like, how do you actually take your own mindset and how fast you can recover from that. And then over here, when we talked about like you talked about like the cases of the polytrauma, and I think you also explained what exactly polytrauma is and how do you prioritize treatment when the patient has multiple life-threatening fractures. So, I mean, like, would you deal with something that's majorly is going to affect him? Like, how do you usually prioritize as an orthopedic surgeon over here? Yeah.
See, the priority is very, very simple. It is always the life over the limb. There is nothing else. So whenever this polytrauma, that is multiple injuries, come, so it is always life over the limb. So whatever is more life-threatening, you first have to treat them. To decide which injury is life-threatening or which needs priority and all is a matter of expertise and experience and all the knowledge you gain from your training and how wise you are to use it or apply it on that particular case scenario. Okay. So, like I've told you, I'll tell you a fact here. I've already told you that you need a lot of disciplines to come together and work in unison, all other specialities and all. That is one thing. And next thing is there are essentially five major regions from which a person can bleed or get injured to death. That also I've told you, your head and neck, chest, abdomen. See, there is accepted data worldwide that there is a subset of injuries which, the most unfortunate thing is unavoidable. That no matter what you do, I think they have to, meet their end even before they come to the hospital. There's nothing you can do in any part of the world. Okay. Rest of the cases which do make it to a hospital, if you take all the cases, all the mortality in those, 50% of those deaths are preventable. 50%, 50. That is, if you take, suppose, say, we are talking about 1,000 deaths, 500 of them are preventable. And a major cause of death in all these is a head injury or a bleeding, a severe head injury or a bleeding, both of which can be treated. These
Mhm.
are all preventable deaths.
Yeah.
So why are we not able to prevent them? Is resource limitation. You can't expect everybody to go to the place at which you are injured.
Yeah.
Now, if you're injured somewhere, your injuries may not be severe, but by the time you reach there, you
Yeah.
see it may be too far, and the mode of transport you reach.
Yeah.
And one more important thing. So this article, so this is my very keen and special area. I published 2 or 3 articles on this regard as well. See,
Mhm.
the lot of decisions in such situation are usually made on the behest of some significant others. They may not be your direct relatives. So there are people surrounding you. There are a lot of factors which play in our country. Better not to name those factors, it will be a controversy. So all those factors, unfortunately, those things, even decisions based on this health and are also taken. I mean, such injuries, management of such injuries, which hospital to take him to,
Yeah.
or what should be done, are also taken on the behest of those significant others.
Yeah.
That is a dangerous trait in our. We can't avoid it because that is how we are.
Yeah.
It has been a part of our tradition. But I think for that, more and more awareness is the only solution.
Yeah.
If you don't tell people what needs to be done and what is actually happening with them and all, they'll continue to do the same. See, it is just like, you know, don't do, see, it's like, don't say that you build the washrooms on the roadside. So please don't
Mhm.
urinate in the public. So
Yeah.
that had to take years and years of ads and awareness campaigns to make people stop doing as small thing as, urinating in
Yeah.
public.
Yeah.
Such major things for them to get awareness, definitely it will take a lot of time and
Mhm.
efforts. I think whatever government is coming are doing their part. Somewhere the public part is lacking somewhere.
Yeah. Yeah.
That we should see how we'll bring it up. So prioritizing is very simple. Life over limb. That's all.
Mhm.
Nothing else. Only one single point agenda. You can't have anything else.
Got it. Yeah. Sir,
Can
I
I
think
can I
we.
answer the call? Somebody's calling me from the hospital. Continues.
Sure, sure.
Is it okay?
Yeah, sure. We can join
Yeah.
the meeting link. I actually send it on the chat, actually. You can take this call. Okay.
Yeah, DP.
Okay. So with that, sir, my next question follows, right? And my next question would be why people, are actually having weak bones? Is that the reason why, even the smallest of injuries is affecting them so much? So what is your opinion on the bone health overall and how it's been? Is it getting better over time, or is it getting worse over time? And why do you think that's happening in the first place? So yeah.
See, regards to bone quality, I think it's a no-brainer for any orthopedician. The bone quality is getting weaker by the day. Okay, it's not getting better. It could be our indoor lifestyle, our toxic food habits, where we eat any and everything which is marketed and publicized, which looks fancy, promising, you know, which has food products which have good ads or which have better places, ambient looking places, gorgeous looking packets. See, we are doing anything and everything which is fancy but not healthy. That is because very much easily accessible, and I think people are socializing over such things.
Yeah.
That is even more dangerous. Okay, so definitely, because I'll tell you, I had a recently a very weird, not recently, since 4 5 years, this has been a common practice. So I get to operate on, let's say, 25, 30-year-old, and all the more, somehow this is more of a problem in females. Operate on 25, 30-year-olds with fractures. So the moment I open and try to fix them, hold them and all, I'm getting, I'm experiencing a bone quality which I usually see in 60, 70-year-olds. So the bones are very fragile. Like if you're muscular enough, if you can just crush the old people bones, just with a pincer grabs between your thumb and an index finger. So that's how bad the bones of too much osteoporotic individuals are.
Okay.
Surprisingly, 25, 30-year-olds are having some of them are having such poor quality bones with no background diseases like some metabolic diseases or anything, or an endocrinal problem, nothing. Otherwise, healthy individuals, poor bone. I think this is a this is turning into a bigger and bigger epidemic, and in no time, this is going to become a pandemic of sorts. If continue our dangerous lifestyles, we have to get out more in the sunlight, see that our body gets enough vitamin D and all that. We have to do aerobic exercises. Go out, go out and do some exercise, walking, running, jogging. Everything indoors is not an answer for, just see comfort at home, I think is problems at life. I don't feel so that's why maybe still rural people tend to have relatively better, you know, bone health and other things because still somehow they have access to the wonderful nature outside. They still have their lifestyles preserved. I think they fare much better in quality of health parameters, I guess so. If somebody ever does a study in India, no doubt rural people will fare better than us. I mean, as presuming you and me both live in the cities. Yeah,
Yeah.
definitely. Lifestyle is the culprit. Nothing got to do with environmental changes or anything. Lifestyle is the one and only culprit for weak bones, at least now.
Got it. Also, sir, with that lifestyle, right? And now that we're talking about how the lifestyle is really affecting the bones, and if not, acted upon, it's gonna like be, it's gonna be like way worse going forward. So that, you see, the bones of some 80-year-old, that fragility in like, in way younger people. And then when we talk
Yeah.
about way younger people, so, what are the common and the most complex thing that you deal with when you're treating children, right? And mostly as much as, adults are also like, getting injuries and all. And I think children are also
Mhm.
prone to maybe during playing or running around, and also the food that we are getting right now is not as nutritious as how a kid would have, like, let's say 3 decades ago, right? And then what is the unique challenge you face with the pediatric orthopedic cases?
I think the unique challenge one has to deal with the children's fractures are their parents. Okay, you will not have that factor for others. They're anxious parents.
Okay.
So, yeah, because I'll tell you why. Because most of the children's fractures do well without surgeries, however bad they look. All they might need, of course, definitely under anesthesia, all they might need is a good plaster for most of the fractures. Okay. And some fractures are like that that definitely need a surgery. But whatever the case, whether that fracture needs a surgery or doesn't need a surgery, the anxiety level of parents is same. Okay. I'm not saying it is wrong. As a parent, they have all the right. And definitely, if I was not a doctor, maybe I would have worried the same if I was a parent. Even as a doctor, I still worry the same. The
Mhm.
very idea that my son runs around, uh, so it always, occurs to me in my mind. I hope this guy doesn't fall and break some bone. Now I don't know how I should treat him, whether it will turn out to be good or not. All these things even come. See, if I can have such sort of a worry, I can understand the worry of
Yeah.
parents. That is a unique thing. I'm not saying that's a troublesome thing for me, but that's a unique thing.
Yeah.
See, because you have to really deal in a very balanced way with them. Okay, most of the children's fractures do well with minimal treatments, but you should know how to do that. And sometimes there are fractures which definitely require procedures, and if you don't do them, the child will have problems. See, when I'm saying problems, the problems of in a child are unique compared to others. Is all these bones are growing bones. Okay, so in adults, suppose if you treat a fracture wrong, he will not have movements, he will have stiffness and all such things. It doesn't heal, he can't weight bear. In children, most important thing is you will get deformities because they are growing bones. You get they might get crooked and all if it's in
Mm.
important regions where a surgery was needed and you didn't operate on them. And if it's in a joint, their joints get stiff and all. The problem is once you don't treat them at the right time, as time passes by, they get more and more and more complex,
Mm.
and they can end up in complications.
Mm.
So you should know what to do and you should know what not to. See, so there are little do's and don'ts. You should not mix them up.
Yeah.
You should not, mix them and make errors. Best thing is suppose if you don't know, because not they are not just miniature adults, they are not just adult clones. So they are a different set of bones. So it is like suppose say you are putting a 30 centimeter plaster for some fracture in adult, it doesn't mean for a child all he needs is a 15 centimeter plaster. It doesn't work that way.
Mm.
Suppose you are putting a this much long plate in an adult doesn't mean you put a half a long plate in child. It doesn't work that way. They are unique. The entire system is unique. They are a different set of population. There is a pediatric orthopedics in itself is a specialty.
Mhm.
So I myself, even after vigorous training for 3 years only in fractures, I myself again underwent training in pediatric fractures because they're a complete different philosophy. So all you need is, knowledge and expertise, that's all. And don't mix up the do's and don'ts.
Mm.
And please keep in mind, child heal, child, children heal pretty well. All you need to do is observe and never, never forget. Please allay the anxiety of the parents. See that out of anxiety, they don't do anything
Got it.
worrisome to the kid.
Got it. Got it. Also, talking about this, right? And then I think before I ask my next question, I think you already answered how different it is to, treat the children from elderly. And then I think we also
Yeah.
talked how, complex the elder cases get and what are the most common thing, which is usually, falling in the washroom or,
Hmm.
somewhere. And I think hip
Yeah.
fracture, something, which are more like, common in elderly, right? And then when we talk about that, sir, so I think it would be, very interesting to have a light over the fact of how, fracture patterns are different in men and women and which gender is more prone, right? And what kind of injuries do you see between these genders? Like, let's say, what are women more prone to have, and what kind of fractures do you see more common in women? And then, how fast is the recovery, or how's the bone health compared to men, and the same for men? Yeah.
Yeah. So pretty much, I think that question is relevant even today. So previously, it's like whatever fracture you take, especially in the younger active age group, almost all the fractures are more common in men because they have been the, active members. And there was a time where at least in 90% of scenarios only men used to go out either for earning a. See, this interview would not be with a girl maybe few years ago. It would be a guy who would be doing this interview. But now things have changed. So we can't, at least for the younger population, I don't think now there is much difference. Still, always males are on a little slightly higher side to get injured in severe injuries because the type of adventures and whatever exposure is little bit more for the males. It's just a relative because of the societal culture and all. In the younger severe injury group, males are on a slightly higher side.
Hmm.
But coming to the elderly, where osteoporosis, you might have heard of it, that is poor bone quality. So
Yeah.
as with age, the bone quality comes down. It is known as osteoporosis. Your bones become less denser. Now
Mm-hmm.
that is a serious problem in women. Why I'll tell you. Because now everybody knows. So women have this thing called as menopause. So after a particular age, they attain a menopause. So that time the ovarian function, everything just simply goes off. All the hormones are cut down. So they are very essential to maintain your bone quality.
Yeah.
So totally after a certain age, they entirely go down. They become zero, right? Almost zero. So just imagine there will be a rapid decline in bone health. So for these osteoporotic fractures, that is fragility fractures, women are at a slightly higher risk compared to men. For the higher energy injuries, Yeah, like I've told you, I don't think today we should be talking about men and women for those injuries because almost everybody are equally active. Anybody can have those injuries, but this fragility fracture, even today across the globe, women are at a slightly higher rate of incidence because of menopause and the subsequent osteoporosis, known as postmenopausal osteoporosis. That's it as to if you ask me who's at higher risk, that
Mhm.
is one group.
Got it. Got it. And I think we also touched upon, how lifestyle is affecting, right, the bone
Mhm.
and the bone related issues, and how are things, with let's say work and stress, and then the rising culture of not sleeping on time, and now it's very cool to talk that, oh, you're insomniac, right, and I don't sleep at night, but usually like the pattern has changed when it comes to your sleep, health, and food, right, and then also added to that work and how less of a physical activity you're having, right. So what would you suggest as a doctor, and what are the things that you need to take care of to have a better bone health? And let alone when you talk about food, what foods would you recommend, like top three, top five that actually helps for
Uh,
good bone health?
yeah, Hafsa. See, you yourself answered the question, right? And you seem to be doing pretty much all those things which should not be done. So you also know that you should be doing all this. Stop them. Quite simple. You don't need a doctor to tell you that everybody is aware and the internet is full of information. Yeah, if I tell you, believe you, trust it, and you would like to do, definitely I'll tell. So these are all called, bone thinning behaviors.
Yeah.
They apply to all the systems, but since we are talking about bones and I am an orthopedician,
No.
so your bone thinning behaviors are lack of exercise, an improper diet, too much of, you and me would be doing that, too much of coffees, you know, the smoking. Smoking has risen, both men and women equally. See, we are in a world, you just go to a coffee shop, I think there's more cigarette smoke than coffee smoke, the
Yeah.
vapors of coffee. Now, that is what I've been seeing lately. Okay, I enjoy my coffee outdoors, but I stopped, okay, because of smoking. Smoking is a very bad for bones, especially fractures. They don't heal in smokers.
Mhm.
Yeah, yeah. I give the patient a 90% chance of his fracture not healing if he's a chronic smoker.
Okay.
Yeah, I give him that because we never actually know how much he smokes. You can't quantify that. You can't test it in something and say that okay, this is how your smoking health has been and also. Anyways, so all these are bone thinning behaviors, not going out in sun, eating too much of adulterated canned foods and all that. Stop all that. That is one way of doing it. Second, how do you increase your bone health? So, this is just like your savings. Okay. You have to save maximum possible in your prime, like till the age of 30. After 30, whatever you do, your bone starts to go away. That is when your bone loss starts. You can slow it down to such a level that it might not make a difference. Okay. You might outlive the poor quality of the bone.
Mhm.
For that, you need to exercise regularly.
Mhm.
So, uh, not top three, but let's say top three categories. You need to take good amount of dairy products,
Mhm.
okay, milk, butters, and good things, not the adulterated and fortified ones. Okay, like how we used to have in our, you know, you are quite younger to me. You might not have had it in your childhood, but yeah, I used to have in my childhood like proper milk, proper curd, proper butter. Okay, proper those vanaspati products and all. Those are not adulterated and all. I think they are responsible for, long hours and hours of physical activity at no fatigue or nothing. They definitely, good quality food is important, not just any milk. Okay. Just
Yeah.
proper, not every processed milk is not good for. So top three is one is have good amount of dairy products,
Mhm.
have good amount of protein,
Mhm.
both animal protein and veg protein. It only boils down to the amount of intake you take. And suppose if you think that you are not having sufficient amounts of this for whatever reason, so job description, anything, it could be anything, you
Yeah.
take supplements. Once you're crossed 40s, 50s, no harm in taking supplements. Elemental supplements, elemental calciums, vitamin D's, nothing harm. Get yourself tested. Take supplements. Not a problem. You can always take supplements. So these are the things you should do to maintain. See, this is just like a bank balance or a mutual funds, whatever language you understand. You can invest only till 30. After that, there's no investment. If your investment is good, you will get interest back in the form of good bone health. If you're not invested, you will go to losses.
Got
As
it.
simple as that.
Got it. Also, so when we're actually talking about, right, make the most out of it the first 30 years. Um,
Mhm.
so I think we already covered over here. And do you see like what is the percentage of the people that you see under 30, coming for the fractures or accidents or something like that? So is it
No,
uh,
no. See, sorry. Yeah, please.
yeah, so is it like anywhere better than after 30 or like how is it right now in the current
See,
cases?
like I've told you earlier, so the type of fractures which I'm seeing in 25s and 30s are not the ones, at least I didn't see them in my postgraduate days.
Mhm.
And to quote my teachers and all, they never saw them
Okay.
in their practice also. Forget postgraduate days. See, a 25-year-old, he falls down trying to get down off a bike, shouldn't have a fracture, shouldn't fracture his ankle.
Yeah.
Forget fracture, we are having some bad fractures. That is, his ankle is breaking at three or four parts. So that is something which we have not seen for us. And only one reason for all of this. See, the injury hasn't changed.
Hmm.
Okay. He has fallen from a standing height. The
Hmm.
injury hasn't changed, but the fracture has changed. So what is the bridge between these two is the poor bone quality.
Yeah, that's true.
Yeah. So it's quite as simple as that. Definitely improve we have to improve our habits. There's no easy way.
Hmm.
There's only one way.
Hmm.
You can't do anything to prevent this from happening. Only way you can prevent is maintaining, ensuring that you have good habits so that your bone health is good. That's all. That is the only way. And accidents, yeah, like I've told you previously, anybody can have an accident. Accidents, not in our hands. But one thing, yeah, that's quite I think it's good that you asked. If you have an accident, the type of injury you sustain depends on the quality of your bone.